You know, artificial intelligence is absolutely transforming medicine. It's promising to help us find diseases earlier and treat them better. But what if there's a hidden, dangerous flaw in the very way we're building these incredible tools? A flaw that could make them fail the very patients who need our help the most. Today, we're going to dig into that critical issue.
So let's just jump right in with a real-life medical mystery. You have a young, healthy patient, just 23 years old, who is suddenly on the brink of death. Their lungs are failing because of a rare reaction to a drug. Now, the hospital has this super advanced AI, a system designed to predict exactly this kind of crisis, but it stays completely silent. No alert, no warning, nothing. And this isn't just some one-off glitch, it's a symptom of a much, much bigger problem.
And that problem? It has a name: the average patient fallacy. It's this fundamental bias that's hidden deep inside the code of medical AI, and it has some really profound consequences for how we take care of people.
Okay, so here's the deal. AI models get really good at recognizing the average patient because they sift through thousands, even millions of cases to find common patterns. In that process, they learn to treat the rare, unusual conditions as statistical noise. Something to be ignored to get a better overall result. The problem is, in medicine, that noise is a person. So, let's dig a little deeper into how this flaw gets baked right into the mathematics of machine learning. How these incredible tools can effectively become machines that only see the majority. Let's use an analogy. Think of an AI model learning from this massive ocean of patient data. It's kind of like it's standing in a vast, crowded room, trying to make sense of everything by listening to all the patient's stories at once. But here's the thing about that room. It's not a balanced conversation. The data the AI learns from is totally lopsided. The common, everyday cases are shouting, making up almost the entire dataset. Meanwhile, the rare but absolutely critical cases, they're just a tiny, almost invisible sliver. And in that crowded room, the AI is mathematically designed to pay attention to the loudest voices, the most common diseases. That's how it maximizes its accuracy. But the quiet voices over in the corner, the ones representing those rare and unusual cases, they get drowned out. They are effectively silenced by the algorithm's programming. And this creates a huge clash of philosophies. On one side, you have machine learning. Its goal is basically utilitarian. Get the best results for the largest number of people. Maximize that overall accuracy. But on the other side, you have the entire history of medicine, which is built on a totally different principle. Every single life has immense value. The rare case is just as important as the common one.
And believe me, this isn't just some academic debate. This philosophical clash has severe, real-world consequences. Let's look at 3 quick examples where the average patient fallacy can lead directly to people getting hurt.
All right, first up, let's talk about cancer treatment. We've all heard stories about miracle cures, right? Where a specific drug works wonders for one patient. Well, an AI that's focused only on the average might just dismiss those rare responses, and in doing so, miss a life-saving breakthrough. Okay, check this out. Somewhere between 10 and 15% of lung cancer patients have a very specific genetic mutation. For this small group, certain targeted drugs aren't just a little better. They can produce miraculous results, sometimes leading to a complete remission. But an AI trained on the average cancer patient is going to see this group's unique biological signal as just an insignificant outlier. It's noise. So the model fails to flag them for this incredibly effective therapy. And the cost is just devastating. For the patient, it's a missed chance at a cure. And for science, it's a lost opportunity to learn from these exceptional responders. Okay, so from the quiet oncology clinic, let's rush over to the emergency room. This is a place where every single second counts, and getting a diagnosis right and fast is everything. So your AI might be an absolute rock star at spotting the typical patterns of a common heart attack. But what happens when a patient comes in with a rare mimic? Something like giant cell myocarditis. It looks similar, but it needs a completely different and incredibly urgent treatment. The AI, trained on the average, fails catastrophically. The cost of that failure is a deadly delay in diagnosis and a lost chance at survival. And for our third example, let's look at something you might not expect: diagnostic imaging. Specifically, screening for eye diseases that can literally steal a person's sight. You have these brilliant AI models trained to spot the most common type of diabetic eye disease, but in the process of becoming experts on that one thing, they can develop a blind spot for rarer conditions, like retinal vasculitis. These might only make up 5 to 15% of serious cases, But the algorithm, laser-focused on the average, can make them effectively invisible. So when you put all of these pieces together, you start to see this huge, glaring contradiction at the very heart of modern medicine's biggest goal. We call it the precision medicine paradox.
I mean, think about it. On one hand, the entire goal of this thing we call precision medicine is to tailor diagnosis and treatment to the unique profile of each individual person. But on the other hand, the standard AI tools we're building to get us there are designed to do the exact opposite, optimize for the population average. We're literally building tools that are fundamentally at odds with our own stated goals. It's a total paradox.
But here's the good news. This is not an unsolvable problem. It's a design choice, and we can and we absolutely must do better. So let's talk about how we can move from just stating our ethical goals to actually implementing real operational fixes.
So, what's the game plan? Well, it really boils down to 3 critical steps. First, we have to start measuring the performance gap. We have to explicitly track how well an AI is doing on rare cases versus common ones. Second, we need to build in a check for overconfidence to make sure the AI knows what it doesn't know. And finally, and this is key, we have to prioritize. We have to build clinical importance directly into the AI's programming, telling it which rare cases are just too important to miss.
And look, this isn't just talk. We can create specific, auditable metrics to hold these algorithms accountable. For instance, we could create something called the Rare Case Performance Gap, or RCPG, which would directly ask, is this model failing on rare cases? And another, the Rare Case Calibration Error, or RCCE, would check if the model is getting dangerously overconfident when it sees something it doesn't recognize. But here's the thing, and this is maybe the most important point of all. This isn't just a coding problem. Deciding which rare cases get special attention, which lives we prioritize protecting with our AI, that's a profoundly ethical and social choice. It's a conversation that has to happen between doctors, patients, ethicists, all of us. Ultimately, we have to make sure our technology aligns with the core moral architecture of medicine. And as this quote so powerfully states, medicine has always valued the exceptional case. It has always demanded a focus on the individual. So to build algorithms that are by their very nature blind to that, that is a profound mistake. And so this leaves us with a critical choice, a fork in the road. The way we design our AI will determine the kind of medicine we practice in the future. So, will we build tools that strengthen our commitment to every single patient? Or will we create a future where our technology, in its relentless pursuit of the average, quietly abandons the most vulnerable among us?